Hi everyone, I'm Emma Eggleston, Dean of the WVU School of Medicine Eastern Division. With rising rates of COVID infection in our pediatric and adolescent populations, and now with the availability of vaccines for kids age 5 and older, I know many of you in our community have a lot of questions about vaccine safety in kids and adolescents. Tonight, we're very fortunate to have with us Dr. Rebecca Furby and Dr. Mohammed Saeed to help walk us through some of those questions and provide us with answers. Dr. Furby was born and raised right here in Jefferson County and was a medical student here in our Eastern Division. She then trained for her residency program in pediatrics in Norfolk, Virginia, before returning to us as a faculty member and medical director for our outpatient pediatrics program. Dr. Saeed also trained at WVU, where he was a pediatric resident in our WVU Morgantown program and chief resident while there. We're very fortunate to have both of them with us caring for pediatric patients in our community and their families, and also helping us understand COVID vaccinations in children tonight. Thank you, Dr. Furby and Dr. Saeed.
All right, well, welcome to our mini med school. This month we're going to do COVID-19 in pediatrics, or kids and COVID. And today I have my good friend.
Hi there, my name is Mohammed Saeed. I'm one of the doctors here at the hospital, primarily functioning as a pediatric hospitalist at Berkeley Medical Center.
And I'm Rebecca Furby. I'm one of the pediatricians out in the Eastern Panhandle, one of the many pediatrics specialists that we have out here. I'm really happy to be a part of the team, and we'll start with our conversation today. So, thank you. What we're going to talk about obviously is COVID-19. It's been with us for about 2 years now. At the time, in 2019, it was a novel virus, which means new to the world, new infection that we've never had to deal with before. It's also known as SARS-CoV-2, or severe acute respiratory virus. And it passes along to people via respiratory droplets. So if I cough or if I sneeze, then I accidentally pass along to another person. Since 2019, there's been a ton of different viruses, or I guess I would say cousins to this specific COVID-19 virus. So we've had Delta variant, there's the Omicron variant, lots of different cousins of the same thing. And nearly 9.5 million kids as of this past Friday have been infected with COVID-19. That means that over the last little bit of time, over the last 2 years, about 17.8% of all infections, both adult and kids alike, have been kids themselves. And over the last 3 weeks, and this was as of last week, it was up to about 11% of all infections, which is kind of crazy.
And that's something we're seeing on our end too. So we've seen, we're coming up on the second anniversary of this virus being here in the United States with us, as starring as it has been for everyone, everyone in the population. It's just been a really tough picture on our end too. So initially what we were seeing, especially with the schools being closed, daycare, child centers being closed, we weren't seeing a lot of infections transmitting from children to children. We see other viruses in the winter season like RSV, like flu, all these different viruses that affect children, but we weren't really seeing any of those in that first winter that came with COVID. So 2020, we hardly saw any patients with RSV in our hospital here, which is just very strange and just kind of felt unbelievable, but it was, it is explained. People were more careful with mask wearing initially in the pandemic. People were keeping their distances. I remember a time where I was wiping down my groceries, so we've all been through that, and obviously it's a little bit different now, but because we, everyone becomes naturally, as a human, we all become a little bit more complacent with these new variants coming in. We are starting to see more kids being infected with this virus, and some of them have been with significant symptoms ending up in the hospital. So that's something that we are seeing on our end too. So not just in the clinics, seeing more of these kids being turning out positive on their testing, but also at the hospital side where we're seeing kids with COVID-19 coming in and being hospitalized for one reason or another, along with the other viruses, because RSV, flu, all those other viruses are back as well.
Yeah, the original corona,
Yeah.
the para-influenza virus, the
Yeah.
flu itself is
Yeah.
all here. So now we're dealing with a huge influx of positive, mild, moderate, or severe infections locally, but globally as well.
So the question is always, we initially came out, when the vaccine came out, the whole movement was to get all the adults vaccinated, especially highest risk first. So that was healthcare workers, people over 65, people with significant comorbidities. More and more people got vaccinated, the more data there was available to judge the safety of these vaccines, and more studies were taking place in terms of safety profiles for these vaccines for children specifically. So that then became, once we did have the approval to go ahead with children over 12, and now there's an approval for children from 5 and up for these vaccines, especially with Pfizer. The question has always been, initially we were not seeing a lot of children with severe illness. Why vaccinate children at all? But now that we're seeing this trend of more and more kids being, not just getting the infection, but getting severely ill, significant symptoms, ending up in the hospital setting, and especially in the ICU, we're starting to see more patients in the ICU for pediatric patients too. There's definitely a strong push to get our children vaccinated and protected against this virus, because obviously we want no harm coming to them. When we were talking about risk factors or comorbidities for adults, we also, there was certain things. So obesity was one of them. But having any other immunocompromised state was another one. But with children, we are also seeing there's certain comorbidities that do put you at higher risk for infection or severe illness. Children with any kind of cancers, children with any kind of immunocompromised state, certain genetic syndromes, they are at high risk for severe illness, and that's why it becomes imperative for us to try to do whatever we can to protect them. And with more and more data that's coming out, we have started to realize that these vaccines are safe, but definitely when we have that benefit that's so high versus the risk of some side effects that we'll talk about later today, it does become important for us to talk about why it's necessary to vaccinate our children.
Yeah.
So when we talk about illnesses for children specifically, it's not just like respiratory illness. There's other illnesses that happen too, specifically a syndrome called multisystem inflammatory syndrome in children, or MISC. That's been a recognized complication of COVID infections in children of all ages. And these illnesses can be really severe. There's some signs where generally speaking, you would have a patient with COVID or having already had COVID, and generally in the next couple of weeks develop some high fevers, rashes, and other system involvement too, and these kids get severely ill and end up in the ICU. So those are recognized complications. We haven't, in the pediatric world, we haven't been immune to children suffering really a lot, especially about 850 children have died from COVID too. So definitely it is something that we need to discuss and talk about and make sure everyone's educated on what the risks are from this infection.
I think one of the things that a lot of people forget too is we use that term long haulers in the adult world, but it also is something that can happen in kids. We're very strict for those who have moderate to severe illnesses, or like what Dr. Saeed said, are in the hospital or in the ICU, on a ventilator, needing transfusions, etc. Those kids really do have a hard time. They miss a lot of school afterwards. They can have a lot of comorbidities, as in, I can't play like I used to, I can't walk like I used to, and needing a lot of therapies afterwards. So it's not just the acute infection, it's the side effects that are long-term afterwards. And then you have those mild infections that could be prolonged. We can have kids who just have significant fatigue and difficulty breathing or just exercising for months and months and months, just like adults. And so therefore, trying to get back to a world in which we are normalizing everyone returning in a safe manner, I think it's super important to do vaccines. So let's get a little bit more into that. Good. So as of this fall, the FDA approved under emergency use Pfizer BioNTech COVID-19 vaccine, which is an mRNA inactivated vaccine. It is approved now down to ages 5, And prior to that, earlier in the year, it was approved down to age 12, which is awesome. I have a ton of questions outpatient asking, well, what's the difference between the shots? So first off, there's 3 different types of shots. There's the Moderna and the Pfizer, which falls under your mRNA, and your Janssen & Janssen, which falls under a different category. We're going to focus over here because we're going to talk about pediatrics.
Right.
And so for now, Moderna is frantically and really hard trying to prove with lots of trials and tests through the FDA that they are able to vaccinate at a younger age group, but they are only 18 and up. For now, Pfizer is the only one approved for 5 to 18 years and older. And there's a little bit of a difference, actually. At 5 to 11 years of age, they are able to get a third of the amount of the COVID-19 vaccine as an adult would. Because studies have shown that a kid getting a third of the amount gets the same effectiveness or protection from that one vaccine and then the second booster dose as an adult who gets 30 micrograms, which is great. So as noted, at about 5 to 11, they'll get a orange top, 10 microgram amount or dose, one dose 21 days apart. Super exciting. Then as you get older and you're 12, you will get the adult dose. And if you have any questions, please refer to your pediatrician about, well, what if I am 11 turning 12, etc. But kids as young as 5 are able to get these vaccines. You know, one of the things that I do in clinic is I describe what type of vaccine this is. There's a lot of concern about, is this vaccine going to give my child COVID? Just like same questions that I've had earlier, is this vaccine going to, like the flu or chickenpox, going to give my child this illness? One of the things I would say in describing this type of vaccine is I like to think of an M&M. Everyone knows what an M&M or a Skittle is. And on the inside where the chocolatey goodness is the virus. That's the portion that is trying to get inside your body and replicate and create nasty, nasty sicknesses and illnesses. Now, the outside of the shell is something that we all recognize too. I love green, some people like brown, etc. But what this vaccine does is it takes the outer shell of that M&M and it replicates it and it gives it to us on a little lipid molecule so that our body can absorb it. And you're like, well, why would we do that? Well, one, I'm not giving you the actual illness, but I'm giving you a little component that you can easily recognize. And I'm mimicking how our body recognizes this in real life. In real life, this nasty little particle from my mouth will go boop, 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 choo. And Dr. Saeed will get it, and it goes inside my body with that capsid or the M&M shell, and then it releases the chocolatey goodness inside, and that's what creates illness. So this vaccine helps to prevent that by kind of giving our immune system a little burst and saying, hey guys, guess what? There's an M&M that could be coming. And it helps us to recognize it sooner rather than later, therefore decreasing the likelihood of us having severe illnesses later on or a prolonged illness needing to go to the hospital.
I do like that example. I think the Skittles one works better because you can choose which one you like better. So like for me, I know which colors I want to avoid.
Exactly.
You're basically giving your body the ability to recognize what those colors are in terms of, the body will already know what the COVID molecule looks like and have an immune response built to it already. Mm-hmm. So what that can do really is what the goal of the vaccines or any vaccine is, it prevents the illness. But not all vaccines work that way. You still can get the illness, but even if you do, the whole point of that vaccine is your body will be in a position already kind of 2 steps ahead, so it's not going to be a severe enough illness to either make you very sick, make you sick for too long of a time, end up in the hospital, or worse than that.
Yeah.
So that's kind of the point behind all of these vaccines, is just getting your body ready and the ability for it to recognize what these molecules can look like. So even if it doesn't exactly prevent the infection, which it does in a lot of cases, mm-hmm. It will prevent it from being severe. But there's also another advantage to it, is if you're less likely to become infected or become severely ill, you're less likely to transmit this infection to someone else. So in a broader public health sphere, it is important for us to prevent the spread of these infections too, especially in children. So we talk about children, less than 5 years of age who don't have an approved vaccine, but we know in both of our different practices, you know, you're in your outpatient world and me in the hospital, children less than that are still susceptible. They still are getting ill, even newborns. And out of the age group in less than 10 years, the more susceptible you are is the kids who are less than 1 year, or even the really teeny tiny ones who are getting infected. And those tend to have more severe symptoms than older kids.
Yeah.
So when we don't have a vaccine to prevent it for kids that age, there is a general broader sense of responsibility that we have as a community to prevent the spread to those younger age groups who cannot get the vaccine.
Yeah, and I think another good point of these vaccines, these mRNA vaccines, is that studies have shown it's effective against multiple variants or multiple cousins of this COVID-19. So we talk about the initial ones, the initial spread in 2019, then the Delta variant that came in the spring of last year, and even some studies show a little bit of efficacy against Omicron as well. So I think these vaccines are proving themselves to be effective to various types of illnesses as far as for COVID-19 and its cousins. So many reasons why it's
Right.
okay to get this vaccine.
Right.
Okay, cool.
So then we talk about boosters specifically. So I know this has been a topic for us, you know, not just in the broader community, but also us as physicians. You know, when we started talking about boosters initially, this is something that I think a lot of people, especially working in infectious disease, kind of recognize that it would be necessary at one point or another to start talking about boosters and boosting that immune response that is built from these vaccines. So that what, you know, when the studies came out and showed in other countries how efficacious these boosters were, we started talking about them, started to apply them here as well. And of course, naturally, that question came down to pediatrics as well, is at what point do we need to consider and start doing boosters? So now the approval from the FDA is for a booster vaccine, but this is specifically for a certain age group, and that is 12 years and older. Of doing a booster vaccines after their first round of vaccines, which is the one vaccine and the second dose about 3 weeks later. 5 months after that second dose, you are eligible, and it is recommended to get another booster dose, just to prolong that immune response and to prolong that protection. So it's nothing new. In the infectious disease world, we have these boosters for other routine childhood vaccinations that we've been doing for years and years with perfect, you know, safety profiles. And it really is recognizing your body's response, because when you do build an immune response, that response does wane over time in terms of how effective it is against preventing disease or preventing severe illness. We do, you know, these routine childhood vaccines, and with boosters, we do boosters for chickenpox, measles. You get your first chickenpox vaccine when you turn 1 year old, along with the measles, mumps, rubella, and then we give you another booster when you're in kindergarten. So we do this for the whooping cough, hepatitis, meningitis, so a lot of different vaccines that we do already do boosters for. Concept is the same, though your immune response, your immunity wanes over time, and we need to kind of bump it up or boost it.
Yeah, and it's the same thing for adults too.
Yeah.
Every time a woman's pregnant, it's recommended for her to get a repeat Tdap or tetanus, diphtheria, whooping cough. In older patients, elderly over 65, it's recommended to continue to get your whooping cough shot as well, and a few other meningitis and etc. boosters. So we have it in both pediatric realm and adult realm. It's not a concept that's new just to this vaccine. And if you talk about boosters that we get every year, let's think about the flu. The flu we get every single year, because we know, just like COVID, it can create variants or cousins, and it can be a little bit different. And so getting a boosted shot every year will help us to decrease the likelihood of having severe illness from those boosted vaccines. Okay, cool. So a lot of people have some hesitations, Dr. Saeed, about this new vaccine, and because it's new, we've only had it for a short period of time. But I do want to say that there's been a lot of research on this alone. Every step of the way, every step has been followed for these vaccines, even though they were emergently utilized to be approved by the FDA. There were no shortcuts. And so in addition to that, there's been thousands and thousands of children, teens, and adults who've attended and participated in these trials. And after all those tests and trials, the FDA said, hey, this is actually okay for us to use. Hence why we've approved to even trial or actually allow kids to have these vaccines.
And that's, that is something that, it's a very natural response for everyone to be hesitant, be skeptical about anything new that comes up, especially in the vaccine world, because we're used to, reading about vaccines, especially the polio vaccine that a lot of people know about, and about how many years of research that needed before that was made public. And then people started getting it, and polio was basically eradicated in most of the world. So the same concepts apply here, but now people, and I understand, again, to be very honest with you, initially when we started talking about vaccines, even before they became available or we knew what companies were making them, I was hesitant too, because I thought it was, very, very soon. But then you start reading the data, and you start reading all these trials that they did and all these people that they vaccinated and the results that they were seeing. So whenever we talk about anything in medicine, especially vaccines, it's always about, risk versus benefit, to show the whole aim is it's easy enough to do, so easy enough to inoculate people without any significant side effects, but the benefits should be there, which should be well worth it. So in terms of this vaccine specifically, we're talking about people either not getting illness, or even if they do get ill,
It's
not
normal.
significant enough.
Yes. And in addition to that, even though we've had thousands participate in these trials prior to it being released to the public, now we have millions of kids who've actually gotten these vaccines with very, very little side effects. In addition to that, so as you can see, over 13 million now, as of this week, teenagers have been vaccinated. And nearly 1 out of 4, or 1 out of 5, right? 1 out of 4 of all kids from 5 to 11 have been vaccinated, which is amazing. That's awesome.
And I feel like, from my experience at least, I don't know how it is on your end, but I feel like kids and adolescents are doing way better dealing with the side effects of the vaccine, as I probably didn't. I can tell you that. But I think children have fared far better in kind of dealing with the vaccine side effects, and we'll talk about those side effects in a little bit.
Yeah, we will. In other news, there's continuing research going on to hopefully have a vaccine for kids as young as 6 months of age. There's thousands of infants and young children, toddlers, who are going through these trials right now. And hopefully that data will come out in the spring of this year, maybe the summer. So we're really hoping to get a bigger population protected by the end of this year. Let's talk about some side effects real quick.
Yeah, so like with any vaccine, honestly, there's obviously going to be some side effects. And when we talk about side effects, it's not so much that this is kind of like an unintended side effect of anything that we give you. So like medications, anything can have side effects. But with vaccines, some of these side effects that we call side effects or adverse events are really just your body's immune response doing what we actually want it to do. So it's basically like when you get an illness and you get all the symptoms and a full-blown illness, and your body kind of makes an immune response to it, and fevers actually are part of that immune response. So the body is trying to get rid of an infection. Fever is going to be one of those things. Chills that accompany those fevers are going to be another one. So this is, some of these symptoms that we experience through an illness are really just our body's immune responses reacting to that illness.
Exactly.
So when we talk about vaccines, some of these more common side effects that we see that most people will experience, kind of like soreness when you get the shot, which is the most common one that we have. Your arm tends to be a little bit sore for a day or two, and then slowly starts to get better. And then, some local redness there, having some fatigue, muscle pain, fever, chills lasting about 24 to 48 hours. Some people do experience that. Less common than the sore arm, but definitely some people have had a different response to it. But all of this, honestly, it's not because you cannot get the COVID infection from it, because the vaccine itself doesn't work that way. But what we intend your body to do, what we intend with this vaccine, is your body to mount an immune response to this vaccine, and then that memory to stay in the body for when the actual infection does pose a risk to you. So some of these, these reactions that we talk about are actually part of your immune response, actually reacting to the vaccine. So even though they're uncomfortable and they're not pleasant for everyone, no one wants to have a sore arm for a day and a half, and no one wants to have chills and fevers, but
it's worth it, depending on if you could be really sick.
Yeah, and because the actual illness is far worse from
people that have had it and have told us.
Yeah.
And what we've seen on our side.
And just for any acute or short-term reactions, we'll have you, if you ask your pediatrician or your provider at their clinic, we'll be monitoring you for at least 15 minutes after the vaccine is given.
So if you have any questions or concerns, we'll be right there.
Right.
Perfect. Let's talk about some other side effects to this COVID-19 pandemic. A lot of discussion in social media and on the news is about mental health, and we talk about that a lot for people who were really quarantined during the early parts of this pandemic in their apartments and stuff by themselves. But we commonly forget how that affects kids. We've seen a lot of mental health related visits over the course of early into continued now the pandemic. We've seen a lot of, unfortunately, emergency room use for pediatric patients. As you can see, between ages 5 to 11, we've seen an increase in ED visits, about 24%. And then in ages from 12 to 17, we've seen up to 31%, which is
We're just
crazy.
talking about mental health related.
Just
visits,
mental
yeah.
health. A lot of our children really do need a big component of their development, which is social interaction.
Right.
And that's really lost over the last 2 years, especially for those COVID babies or those who were born during the first 2 years of the pandemic.
Having one of those at home, I mean, we're really talking about kids who just have had a really different, vastly different experience to what life and the world looks like when you're looking at it from a toddler or from a real young baby. People, seeing people in masks and never having seen them without one. And then not being able to go and socialize in all the normal settings that we took for granted. Even whether that just be as simple as going to the grocery store. So I took my daughter to the grocery store and she didn't
know what to do.
Couldn't process what it was and what was around her. So it does not just like mental health, related issues, but also just early childhood development, I think, is definitely affected because of how different 100%. The world has been for these babies that are born in the last 2 years.
So we see a lot of mental health diagnoses, acute, which means short term, I feel like I'm going to hurt myself or someone else. We see a lot of chronic depression, anxiety with, like you're saying, going out into the world again. And we've also seen, unfortunately, the flip side of that, which is the children who are affected by deaths of a parent, a loved one, a grandparent, etc., who have unfortunately experienced that. That's a hard loss. And unfortunately, during this pandemic, we can't really reach out and be with the other people that you love. So we've seen a lot of kids who've at least over 140,000 been affected by a loved one lost or because of COVID-19.
Especially early on in the pandemic when we weren't visiting our grandparents because of the risk of getting them infected. Those things were really hard to process. The younger you are, the harder it is to process all this information. By how would you explain to a really young 3-4-year-old why you can't visit the grandparents? It's generally been really tough for the entire community.
Well, let's talk a little bit more about some misconceptions to hopefully get us back to a normal type of world again. So some of the misconceptions we wanted to address today. Dr. Saeed, you can get myocarditis from COVID-19 infection, or vaccination, excuse me.
So not entirely true.
What?
So basically myocarditis is basically what it is. It's an inflammation of your heart muscle, which can happen for a lot of different reasons. And COVID-19 vaccination has been one of those things that people have postulated that it is causing myocarditis in kids. Turns out it's have been reported a few cases, rare few cases, and we're talking about a few in a million. But then we're also now considering whether these kids are also getting myocarditis from actual COVID illness itself. And actually, it turns out, looking at this data and the studies, the risk of actually contracting myocarditis from actually a COVID-19 infection is far higher, or 6 to 34 times higher compared to those who receive these vaccines. So yes, it is a risk, but it's a very, very rare risk. And again, when we talk about vaccines, when we talk about these much rarer side effects, we have to consider risk versus benefit. It's a risk that is so tiny and so rare in these cases, worth not protecting yourself from illness that can be much worse.
And I like to mention too that when we talk about myocarditis from the infection of COVID-19 and not the vaccination, it really does affect our athletes, especially our adolescents. We have a lot of adolescents who want to return to wrestling, basketball, football, but they've had a moderate to severe illness or even a mild to severe illness of COVID-19 and have to be cleared by a cardiologist because they've been affected by myocarditis, etc. So I think it's something that we really have to consider. You're more likely to be exposed and infected and have those side effects or complications and then can't return to the things that you love
Right.
if you don't get your vaccine.
Yeah, nothing harder than telling an athlete that you can't
Oh
play.
gosh, I know, it's heartbreaking.
Yeah.
All right, you go ahead and ask me a question.
So I've had the COVID infection already. Do I really need the shot anymore?
Yes, you should get your vaccine, just for the reasons why we discussed before. This vaccine has shown efficacy against not only one variant, but multiple variants of COVID-19. And they're all still out there. We've all heard of the new one, Omicron, and we're still testing to see how efficacious or how effective, how good this vaccine is against that variant. But there's still the old ones out there too that can still cause severe illness.
Right. So over the course of the last 2 years of this pandemic, we've seen already like 3 major variants that
Exactly.
are very apart. And we've seen people who've been infected by one get infected by the other one. So
Yeah.
yes, with most infections, your body does mount immune response and does stay in your memory, in your body's immune response memory for a certain bit of time. But again, like with the vaccine, that immune response does wane over time. So plus, if you get infected with one variant, does not mean that your body knows how to deal with other variants too. So
Exactly.
you still couldn't get infected with other ones.
Yeah.
And Delta hasn't gone away.
Delta
I know
hasn't
we're
gone
dealing with
away,
Omicron,
right.
but yeah, it's still out there.
And when we talk about variants, I know we mentioned it before, but I also like to akin it to that M&M model of, I like green M&Ms, but there's a brown one that came around. There's a yellow one that came
Right.
around. There's a red one, and these vaccines are still good against it.
Right.
All right, let's go to the next question. Go ahead, you can ask me a question.
So I've heard it affects fertility and pregnancy. Should I be really getting this or considering this for someone who's pregnant?
Yes, you definitely should. So early on, there were studies or papers, let me say, that came out from experts that were concerned that this could affect fertility. And time again, that was proven false. There are unclaimed or unfounded claims that COVID-19 vaccine can reduce or decrease your likelihood of getting pregnant. And if we flip over to our colleagues in the obstetrical world, or ACOG, which is the American College of Obstetrics and Gynecology, they have their own statement about COVID-19 and its vaccination. And they highly recommend anyone who's pregnant, breastfeeding, or postpartum, which means within 6 weeks after you've delivered, to get your COVID-19 vaccine.
And the more and more people they've been vaccinating in their clinics and their practices, they really haven't been seeing any overt
Right.
side effects, more so than the general population getting it. So
And personally, I have a ton of colleagues who got pregnant during this pandemic, during or after an
Right.
infection,
Right.
and have had no complications. So I think we have millions of data points to say this is not true. All right, Dr. Said, I have one for you. I received this shot, so I don't have to wear a mask, right?
So not true. Again, like I said, the shot does protect you, and the aim is that you don't get the infection at all. But of course, none of these shots, even the COVID infection itself, is not perfect in immune response. You still could get the infection, especially with the new variant. Though, again, the secondary aim is that if you do get the infection, you're not going to be ill enough to have significant symptoms, have you down for a while, or even end up in the hospital or worse. So, like I said, you could still get the infection. The fact that you have the infection, have almost no symptoms, you still are prone to or susceptible to transmitting it to other people. So that's why the masks come in. Now, one of those things that we always have to differentiate in terms of when we're talking about masks, and this is something that I think a lot of people have misconceptions about, is if the masks don't protect me, why do I have to wear it? And that's something that we have to talk about too, is the masks, depending on what mask you're talking about, there's a different role for each one. So when we talk about the simple cloth mask that most people wear, or surgical masks, it's true, it's not going to protect you, but it is going to prevent you from spreading it. So if you were to sneeze or cough or just talk in an environment, it's less likely for you. So if I were wearing a mask, to transmit the infection to you. And that's kind of what we have as a responsibility to each other in the community, is wearing these masks, as inconvenient as it may seem, because we're trying to stand up for each other and protect each other as best as we can, especially people who can be vaccinated or who are more susceptible to these illnesses. So if there's a risk, again, even when you're fully vaccinated, if you can transmit this infection to other people, then the idea is to mask up, not so much for yourself, but for each
other
other.
people.
Yeah.
And I think that's a huge mantra in healthcare, is that do no harm to our patients. And that's what we stand on, that's what we pledge,
Right.
or we have an oath for at the start of our medical journey, is to do no harm. And we'd like to implement that to everyone else in our community. When you go to the store and that person sneezes on those vegetables, oh my, do
Right.
no harm, wear a mask and
Right.
help prevent
Right.
that illness being spread. Same thing for children. So I have one for you that I've commonly had. Well, masks interfere with my child's lung development. They don't have to wear a mask.
Right. And it is something that's, for a lot of people, everyone who has children, it does seem unnatural for their young child to be wearing masks. And the recommendation is for children over 2 to be wearing masks, or children, they should have the ability to take off the mask if they need to. So if anyone who has any developmental disorders or anything that might prevent that from happening, the recommendation is not to have them wear a mask. So it does seem unnatural for any child. We have all these young toddlers or young children running around the grocery stores wearing masks. It does seem unnatural, but it really doesn't do any harm to them, because
It doesn't.
again, the point of the mask is not to prevent infection to yourself as much as it is to prevent you from spreading it. So even though children are less likely to get severe illness, they are still as likely to transmit it to someone else.
Exactly.
When they cough or sneeze, and
Yeah.
we all know children, they're not gonna cover their mouth up.
They're
when
not gonna know
sneezing.
how to.
Yeah, and you
So
see this all the time.
Yeah. I love that there's a lot of families out there training to sneeze in your elbow.
Right.
But when we're in public places, it is appropriate for a 2-year-old and up to wear a mask if they're developmentally appropriate. And when we talk about masks allow transmission of oxygen and CO2.
Yeah.
And so it allows us to still be able to do the basic function of breathing. It
Right.
doesn't change that.
Right.
And so kids will do just fine.
Yeah, and that's one of the bigger misconceptions, is that we're wearing masks, we're actually retaining carbon dioxide that we're supposed to expel out of our lungs, or
Yeah.
being, interfering with our ability to inhale oxygen, which is not true.
It's not true.
Especially
Yeah.
with a cloth mask, and most people
Yes.
are wearing these cloth masks. The pores in them are, large enough
Very
to easily allow carbon dioxide and oxygen to pass through.
Exactly.
It really is the droplets that Dr. Furby mentioned initially in this talk, is the droplets where we generate from coughing, sneezing, even talking, that are going to transmit this infection from person to person. And these cloth masks, what they do best is prevent those droplets from exiting you and going and landing on a surface or another person.
Love it. All right, let's talk about a very common question that I get through all of my internet messages and calls. As the CDC recently changed some recommendations that they initially had. In the beginning of the COVID pandemic, we all were instructed to quarantine at home to minimize being within 6 feet of people. And now, as the pandemic has progressed, we've changed that. And as of December 27th of 2021, they've had new recommendations on how to or when to quarantine. And it actually changes based on your vaccine status. So, for example, isolation itself is not quarantine. Isolation is when you are at home because you are infected with COVID-19 and you have symptoms. You stay at your house for at least 5 days, 5 full days. And then if you have to, let's say, take care of a baby or an elderly person, or someone has to be around you within your household, you have to wear a mask. Then after day 5, you can go ahead and get a swab. Or you can go back to work wearing a mask, appropriately fitting mask, if you're fever-free without taking any antipyretics or medicines that decrease fever within 24 hours time.
That's right. And then we talk about quarantine. So what is quarantine itself? Is basically trying to, so if you are at risk of contracting the infection but don't yet know that you have the infection, then what do you do in that case? And then that rule will be different for depending on if you've had the vaccine or not. So if you're not vaccinated, if you do get exposed to a positive case of COVID, or you're really suspicious or worried that you were exposed, then the recommendation is to quarantine yourself at home for about 5 days. Wear a mask when you're around other people who have not been exposed, and then on day 5 of that exposure, you can take a test, depending on if you have symptoms or not. And then the other side of the thing is you watch out for symptoms for about 10 days. Again, the goal behind that is because if you're vaccinated, you're less likely to transmit this infection or have this illness for a long time. But if you're not, then you might have symptoms that are prolonged or have the shedding of the virus for a little bit longer. So the recommendation is to wear a mask for about 10 days and watch your symptoms. And that changes a little bit if you're vaccinated.
It does change. I'm so excited. If you're fully vaccinated, which means you have those 2 initial shots, not even a booster yet, then you can technically go out and, as long as you're wearing a well-fitting mask, continue your life and lively projects. And you can get swabbed on the 5th day.
Right.
But if you do show symptoms, you should start quarantining at home.
Right. So if you have an exposure, let's say, a lot of common picture that I can see is if you're exposed, then you start having symptoms day 4, then that probably means that you're infected. And yeah, it is a good idea to go ahead and get tested to confirm that and take the right precautions. But also, even before you know, if you have an exposure and you have symptoms, go ahead and start taking those precautions even before you confirm the infection.
Yeah, awesome. Let's see what else. All right, so in summary, with kids and COVID-19, it's kind of like adults, but a little different.
Right.
We have now a vaccine down to age 5, which is great. The AAP, or the American Academy of Pediatric, recommends that all people 5 years and up get their COVID-19 vaccine. Right. And those who are expecting, especially in that age range, should get their COVID-19 vaccine as well. The other thing is that you can get your vaccines with other routine vaccines, as in when you come to us in clinic for your well child check or whichever, and you're getting multiple vaccines, that's okay.
Right. And another important thing I think is, like, when we talk about vaccines, it's important to not forget about all the other precautions that we were taking even before the vaccine became available, and those were social distancing and masking. The interesting thing, especially from my end, from what I see on the hospital side, is the bane of all pediatricians and all children under 2 is RSV and all these other viruses that cause significant illnesses and significant symptoms in all these patients. We're talking about children who are under 2. The trauma that it has to end up in the hospital with any of these infections is really, it's a big trauma. That it takes a big toll on their health, but also their mental health at the same time. So these are other, measures that we were taking that actually were working really well, and it wasn't surprising to anyone working in healthcare how we didn't really see a whole lot of RSV cases or a whole lot of flu cases in that first year of the pandemic. Because these general measures that everyone can follow actually do work for other viruses too.
Exactly.
So that's the brilliant part of it, is not only are you preventing COVID and all these infections and do affect the whole community, but also especially we're really protecting our younger ones from all these other viruses that you may have. And as an adult, you might not even have any symptoms from RSV. But for someone who's under 2 or really, really young ones or really newborn, they can get significantly ill.
100%. So vaccines work. Please consider to get your shot. If you have any questions, concerns, comments, or want a more in-depth discussion, please message or call into your pediatrician or provider's office. And there'll be lots of links on the description for Facebook or YouTube.
Yeah, or the YouTube video description. You can just look up some of those references there that are really, peer-reviewed, and a lot of these references are actually great information if you want to do your own reading and get informed, or even after that, if you have questions. I always have questions, so if you want to ask, just ask your pediatrician or your healthcare provider, and they'll be more than happy to discuss this with you.
Thanks for coming out, Dr. Saeed. I appreciate it.
Hopefully we can all take the right steps together as a community, protect ourselves, but also make sure we protect everyone around us from getting these illnesses and others, and hopefully get through this together. Thanks, guys.